Hello everyone. Today we will be talking about thyroid storm. So what is the definition? Thyroid storm, that is also referred to as thyrotoxic crisis, is an acute life-threatening hypermetabolic state induced by excessive release of thyroid hormones in individuals with thyrotoxicosis. So what's the pathophysiology? Thyroid storm is a decompensated state of thyroid hormone-induced severe hypermetabolism involving multiple systems and is the most extreme stage of thyrotoxicosis. The clinical picture relates to severely exaggerated effects of thyroid hormones due to increased release, with or without increased synthesis or rarely increased intake of thyroid hormone. Heat intolerance and diaphoresis are common in simple thyrotoxicosis but manifest as hyperpyrexia in thyroid storm. So basically in usually thyrotoxicosis we see heat intolerance and diaphoresis, while in thyroid storm it's usually manifested as hyperpyrexia. Extremely high metabolism also increases oxygen and energy consumption. Cardiac findings of mild to moderate sinus tachycardia in thyrotoxicosis intensified to accelerated tachycardia, hypertension, high output cardiac failure, and a propensity to develop cardiac arrhythmias. Similarly, irritability and restlessness in thyrotoxicosis progress to severe agitation, delirium, seizures, and coma. Gastrointestinal manifestations of thyroid storm include diarrhea, vomiting, jaundice, and abdominal pain, in contrast to only mild elevation of transaminases and simple enhancement of intestinal transport in thyrotoxicosis. So, what is the etiology? What's the cause of thyroid storm? Or what precipitates the thyroid storm? So, sepsis, surgery, anesthesia induction, radioactive iodine therapy, drugs such as anticholinergic and adrenergic drugs e.g. pseudoephedrine, salicylates, nonsteroidal anti-inflammatory drugs, chemotherapy, etc. Excessive thyroid hormone ingestion, withdrawal of or non-compliance with antithyroid medications, diabetic ketoacidosis, direct trauma to the thyroid gland, vigorous palpation of an enlarged thyroid, toxemia of pregnancy and labor in older adolescents, and molar pregnancy. So, what are the diagnostic signs and symptoms? Fever, tachycardia, altered mental status, vomiting and diarrhea, cardiac arrhythmias. So, these are just the common signs and symptoms of hyperthyroidism. So, how do you diagnose thyroid storm? Diagnosis is primarily clinical and no specific lab tests are available. So what is the workup? The diagnosis of thyroid storm is based on clinical features, not on lab test findings. If the patient's clinical picture is consistent with thyroid storm, do not delay treatment pending lab confirmation of thyrotoxicosis. Results of thyroid studies are usually consistent with hyperthyroidism and are useful only if the patient has not been previously diagnosed. Usual findings include elevated triiodothyronine T3, thyroxine T4 and free T4 levels, increased T3 resin uptake, suppressed thyroid-stimulating hormone levels, and an elevated 24-hour iodine uptake. TSH levels are not suppressed in the rare instances of excess TSH secretion. Chest radiography may reveal cardiac enlargement due to congestive heart failure. Radiography may also reveal pulmonary edema caused by heart failure and/or evidence of pulmonary infection. Head CT scanning may be necessary to exclude other neurologic conditions if diagnosis is uncertain after the initial stabilization of a patient who presents with altered mental status. What is the management of thyroid storm? The approach to treatment of thyroid storm includes the following. So the supportive measures give antiadrenergic drugs, thionamides, iodine preparation, glucocorticoids, bile acid sequestrants, and treatment of the underlying condition, basically what had precipitated the thyroid storm. And really you may have to perform plasmapheresis. What are the complications of thyroid storm? High output cardiac failure, cardiac arrhythmias, delirium, seizures, coma, abdominal pain, diarrhea, vomiting, jaundice, and elevation of transaminases. So that's all about thyroid storm. If you like the video, please like, subscribe, comment. Thank you.